Hello everyone, welcome to the first video of the video series on the discussion about breast cancer. In this video, we are going to discuss about risk factors for breast cancer. This is an important topic for all of you, for your theory papers and also to face your long case examinations. I have categorized these risk factors for the easiness of remembering as non-modifiable, reproductive and modifiable risk factors. So I have included 7 non-modifiable risk factors, 4 reproductive risk factors and 6 modifiable risk factors. The number of these risk factors may vary according to the textbooks and the literature you are referring to. However, for the easiness of remembering, I have numbered these. Then you can easily remember. So let's look at what are the non-modifiable risk factors for breast cancer. The first one is increasing age. In women, from birth to 50 years, the risk of breast cancer is 2.1%. Those older than 70 years, the risk of breast cancer is 7.0%. So you can understand that with increasing age, the risk of breast cancer has increased. So, increasing age is a risk factor. Then female sex. Female sex is a risk factor for breast cancer, and women have 100 times higher risk of breast cancer than men. So, female sex is a risk factor. Then white race. This is more applicable to American population. If we get a white women and black women, then white women have higher risk of breast cancer. Then family history of breast cancer in first degree relatives. So if someone is having a first degree relative who's having breast cancer, then it is a risk factor. And also the age they were diagnosed is an additional risk factor. If in our relative the breast cancer is diagnosed earlier, then the risk of breast cancer in ourselves is higher. If someone is having one affected relative, then there's twofold higher risk of breast cancer. But if there are 2 affected relatives, there is threefold risk of having breast cancer. So like that, you can understand that family history of breast cancer in first degree relatives, and also if it is diagnosed earlier, then it is a risk factor. And also tall stature. This is a research found fact that tall stature is a risk factor for breast cancer. And women taller than 175 centimeters has 20 times higher risk of breast cancer than those shorter than 160 centimeters. Then, proliferative benign breast disorders. And benign breast disorders we can categorize as non-proliferative or proliferative. So you can go back to that video and recap on what are the proliferative benign breast disorders. And if you are having any proliferative benign breast disorder, then the risk of breast cancer is higher. Then, dense breast tissue. Usually this is found in screening mammogram. If the breast tissue density is high, then the risk of breast cancer is high. So like that, you learnt about the non-modifiable risk factors of breast cancer: increasing age, female sex, white race, family history of breast cancer in first degree relatives, tall stature, proliferative benign breast disorders, and dense breast tissue are the non-modifiable risk factors for breast cancer. So you need to remember all of these. Then let's look at the reproductive risk factors for breast cancer. So this is with regard to the reproduction. Early menarche and late menopause, then the exposure to estrogen is higher. Then the risk of breast cancer is high. And also later age at the time of first pregnancy. Especially if it is more than 35 years, the risk of breast cancer is high. compared to a nulliparous woman near menopause, if the age at the time of first pregnancy is more than 35 years, the risk of breast cancer is higher by 5%. So, late age at the time of first pregnancy is a risk factor. Then, absence of breastfeeding is a risk factor for breast carcinoma. Breastfeeding is a protective factor. And also, nulliparity is a risk factor for breast cancer. So, you learned that there are 4 reproductive risk factors: early menarche and late menopause, late age at the time of first pregnancy, absence of breastfeeding, and nulliparity. Then let's look at the modifiable risk factors for breast cancer. BMI, how that can affect the risk of breast cancer. In postmenopausal women, higher BMI is a risk factor for breast cancer. Particularly for ER positive, estrogen receptor positive breast cancer, higher BMI is a risk factor in postmenopausal women. However, in premenopausal women, higher BMI reduces the risk of breast cancer. So, BMI affects differently for the risk of breast cancer according to the state of menopause. It is a risk factor for postmenopausal women, but it is a protective factor for premenopausal women. Hormone replacement therapy with combined estrogen and progesterone is a risk factor for breast cancer. However, in patients with hysterectomy, single-agent contraceptive pills containing estrogen is not a risk factor. So, hormone replacement therapy is a risk factor, but single-agent contraceptive pills containing estrogen is not a risk factor and it may be a protective factor. And also, current or recent use of combined oral contraceptive pills is a risk factor. However, the risk of breast cancer disappears 2 to 5 years after stopping these combined oral contraceptive pills. Then, alcohol use and current smoking is a risk factor, and higher bone mineral density is a risk factor, and exposure to therapeutic ionizing radiation is a risk factor. This exposure to therapeutic ionizing radiation can occur in treatment of Hodgkin lymphoma and also in survivors of atomic bomb or nuclear power plant accidents. So, exposure to therapeutic ionizing radiation is a risk factor. So, those are the modifiable risk factors. The BMI, which affects differently to postmenopausal and premenopausal women, hormone replacement therapy with combined estrogen and progesterone, current or recent use of combined oral contraceptive pills, alcohol use and current smoking, higher bone mineral density, and exposure to therapeutic ionizing radiation. So those are the modifiable risk factors for breast cancer. So now you know about the non-modifiable risk factors, reproductive risk factors, and modifiable risk factors of breast cancer. Now let's look at few questions. Here is a part of a question. So it asks predisposing factors for breast carcinoma. Breastfeeding is a protective factor, not a risk factor, so A is false. Family history. Yes, family history of breast cancer in first degree relatives is a risk factor, so B is true. In this question, it is asked, what are the risk factors for breast cancer? So we have to select which of these statements are true or false. Statement A mentions bilateral oophorectomy at 35 years. So you know that bilateral oophorectomy is an iatrogenic cause for menopause. So after oophorectomy the patient enters menopause, then it is not a risk factor but it is a protective factor. So A is false. B, nulliparity is a risk factor, true. C, postmenopausal drug therapy. I think this must indicate something like hormone replacement therapy. So if it is hormone replacement therapy, then it is a risk factor. Then D, positive family history. Yes, for positive family history of breast cancer in first degree relatives is a risk factor. Then E, breastfeeding is not a risk factor but it is a protective factor. Like that, questions may be asked in your multiple choice questions paper.